I'm Dr. Emily Vincent, a medical director from Louisiana Blue.
And I'm Dr. Tracy Lamel, another medical director from Louisiana Blue.
And we're here to talk to you about breast cancer health and awareness. While October is technically Breast Cancer Awareness Month, we think that every month should be Breast Cancer Awareness Month. You know, the good news about breast cancer is that the American Cancer Society has said that over the last 35 years, death rates from breast cancer have dropped 44%. Now, why is that? There's a lot of different factors. You know, number one, we have a lot of awareness about it, and that has spawned tons of amazing research, great new therapies for breast cancer, and people are really becoming more aware that early screening means saving lives. And we want to really hit home on the screening, because when you get screened and you catch breast cancer at its earliest stages, it's generally much, much easier to treat. So what does screening mean for you? Well, in general, if you're an average risk woman or man, because men can get breast cancer too, I'll let you talk about that a little bit later, but let's just talk about women right now with breast cancer screening. If you have an average risk, we're generally going to say you should start your screening with mammography at age 40. Now, that's going to vary in a lot of different people, and here's why. Your genetics, your family history is your genetics and your family history. And because of the way we're all made differently, it may mean that you are eligible for early or even different types of screening for breast cancer. If your mom had breast cancer at a young age, if you have an extensive family history of breast cancer, if you know that your family has a genetic predisposition for breast cancer, it's going to mean a different thing for you. And the only real way you're going to know when the best time for you to start that screening is to start by a discussion with your doctor.
Absolutely. And a wellness visit is a great time to do that. All of us should be having a wellness visit at least once a year to begin with,
right,
from jump. But if you're having symptoms, if you've noticed a lump, a bump, a skin rash, if you've noticed changes in your menstrual cycle, any of those things are a wonderful opportunity to talk to your doctor. And they can talk to you about ask questions about your family history and what's going on in your life, so they can direct your care so that it is individualized to you and your situation. But any time is a good time to talk if you notice things going on in your life. Also, as Emily mentioned, men have breasts too, and men get breast cancer too as well. It's not always on our radar, but men, I'm relying on you to speak up, because it may not be on your oftentimes male doctor's radar either, unless they know about your family history. So it's important. If you know your mom had breast cancer, your sister had breast cancer, your grandmother had breast cancer, bring up that history, because when a large group of people on either side of your family has breast cancer, it increases your risk as well. Not to mention, finding out if you have male breast cancer is important for your children.
Your whole family.
Your whole family. An incidence of male breast cancer is a huge it increases the risk of other people in the family having breast cancer as well. It is definitely a red flag. So knowing your situation is important for the rest of your family. And an annual well visit is a great time to find out about other preventive services that may be available to you, considering your situation. Colonoscopy, breast cancer exams. I said breast cancer exams. I'm sorry. Prostate cancer exams. Yes, I was talking about men. I was thinking about men. Prostate cancer exams, colonoscopy, pap smears. There are a ton of other things that happen at a preventive well visit that you need to know about. So see your doctor at least once a year, discuss any concerns you may have, and learn what else needs to be done to help you be the healthiest you can be. And we'll be right back with more after this break.
I'm Dr. Emily Vincent with a health note. Cancer screenings save lives, so it's important to keep up with them. If you're a woman 40 or older, I want to remind you to speak to your doctor about a mammogram. And if there's a family history of breast cancer, your doctor may recommend you get your mammogram sooner. Mammograms and monthly self-exams can help detect problems early when they're easier to treat. So call your doctor and schedule your mammogram today.
And we're back talking to you a little bit more about breast cancer and just your health journey in general when you've been diagnosed with cancer. We at Louisiana Blue have an amazing health team that can help you through your cancer journey. Over 300 doctors, nurses, dietitians, pharmacists, health coaches, social coaches as well, social workers that can help you navigate what is going to be a very confusing time often through this journey when you have a new diagnosis of cancer. So something that we encourage you to access, because a health coach is part of what you're paying for in your health insurance premium. It's going to be accessed at no additional cost to you. So we really encourage you to reach out and to get a health coach that can assist you in navigating doctor's appointments, medications, figuring out what may be in network, out of network for coverage. A lot of different questions are going to come up, and we want you to be able to use those resources that we have. In fact, we have an exciting new feature here at Louisiana Blue. My LA Blue was just launched. It's a digital platform where you can access information about your health care in addition to your health benefits. And you can access it through MyChart, or we have an app. We have an app for that.
We do have an app for that.
And we have an app for that. And what you're going to find is it's like one-stop shopping for all of the information you need as to, is this in my network? We talked during one of our visits together about finding imaging that was more cost effective. So these are the kind of things that you can access on the My LA Blue app or through MyChart, finding out if you're up to date with your deductible and what kind of things you may owe as far as with the different services that your doctor wants you to have. It's just an easier, all-in-one platform that you can access anytime and anywhere. So essential tools really for your healthcare journey.
Absolutely. And I do want to say one more thing about health coaches. When you get diagnosed with cancer, you're so overwhelmed
Absolutely.
by what is going on in your life and how your life has changed for you and your whole family that 9 times out of 10, you don't even know what to ask. And a health coach who does this every day, all day long, that's their job. They know what questions and what answers to give you that you didn't even think to ask. They know what you don't know to ask. Also, back to the lablue.com. It is a great app. And many of our members have MyChart. And if you know how MyChart works, you already have different institutions on your MyChart, whether you're going to Women's Hospital, Ochsner, Baton Rouge General, or even Baton Rouge Clinic. You can add the My LA Blue institution to your MyChart app, just like any of those others. And then you have all of the information in one place.
All in one area.
Exactly. You can see your
so much easier.
visits, you can see your medications, you can know your deductible information, who's in network, who's out of network. You can look up prescriptions. What tier is your prescription? How much are you likely to need? And the best part, the reason more people call customer service than any other reason is they lost their insurance card.
Right. In fact, I was actually planning on that yesterday because my son needed a copy of his insurance card for school.
Absolutely.
I was able to take the picture of it from the My LA Blue and I was able to send it to him. So
I haven't carried an insurance card in years. Thanks to digital technology. So all of those things can happen, one-stop shopping, one place, and we can absolutely guide you in getting there. Like I said, if you don't have MyChart, you can go to the My LA Blue app and download what you need. Or worst case scenario, if you have your insurance card, you can flip that card over, call customer service, and they can guide you through steps as well.
So we really have the real human aspect that you can access, with health coaches and customer service. And then we have for the more techie people and really just the everyday people
Or
like myself. Or forgetful people.
Yes.
The My LA Blue app is just a really great resource we've added.
Absolutely. Thank you so much for joining us for another episode of Direct from the Doctors. I'm Dr. Tracy Lamel.
And I'm Dr. Emily Vincent. Thanks for joining us today. It's been a pleasure.